All right, well, thank you. It's an honor to be here today to talk about parks and physical activity. I'd actually like to first start, though, by just going over a few of the broad benefits of parks that has been demonstrated in the research. This includes protecting the environment, as well as enhancing real estate values, attracting and retaining business by providing appealing places to both live and work. Research also demonstrates that parks can help play a role in preventing youth crime and promoting youth development, as well as facilitating community pride, connectedness, and social capital. In addition, parks really do play a role in promoting individual health. There's significant research that demonstrates the health benefits from contact with nature, including even just viewing nature can help reduce blood pressure, also reduce stress, and provide other cognitive benefits. But what I'd really like to focus on today is the physical health benefits of parks through promoting opportunities for physical activity. As you're likely aware, people find many interesting ways to avoid being physically active. However, we're seeing that parks can really provide important behavior settings in communities to promote both physical and social activities. And in particular, as coupled with other motivations for visiting parks, physical activity in parks can actually be very intrinsically enjoyable and satisfying. So there's increasing interest on how parks can help contribute to community health and serve as a physical activity resource. Parks are free to low-cost resources within the communities, and therefore they really have a wide reach across the population. Research also shows that greater proximity to park spaces is associated with increased physical activity among both youth and adults. But we're also seeing that park features and other characteristics can be just as important as proximity in encouraging park-based physical activity. And this is really around a lot of what my research has been about. And so today I'm going to give a few examples of some studies and select findings that sort of highlight some of this research. I want to say from the start that I'm providing sort of an overview, so I'm not going to be able to get into a lot of the exciting methods and details, but if you want any more information on that, I'm happy to provide that later. So the first study I'm going to talk about was an effort to evaluate interventions to improve physical activity in fourth graders in 4 Columbia, Missouri schools. And as you can see by the investigators here, this truly was an interdisciplinary effort. And what we're trying to do is understand where in the environment, in the community, youth were engaging in physical activity, factors that influence that physical activity, and then also evaluate the impact of a playground intervention. And this intervention was designed through a participatory approach, including principals, teachers, parents, and the youth. And we had interventions that ranged from a new soccer field to a track, and even in one school they put in a new Frisbee golf course on their playground. We collected a vast amount of information through a variety of different measurements, and I'm going to just highlight a few. For one thing, we gave youth accelerometers and GPS units so we could see where in their community they were being physically active. We also engaged in photo voice with the youth, and this was where we gave them small digital cameras and told them to take pictures in their community about their experiences, and then had some follow-up interviews. So again, I'm going to highlight just a few of the key findings from this. With regards to where they're going in their communities for physical activity, we see that during the week their physical activity is really clustered around schools, while on the weekends that physical activity tends to be more dispersed. Most of the activity was occurring around school and home, and only 2% of activity was actually occurring in parks. However, we did find that parks emerged as a significant predictor of the youth's physical activity. So therefore, that does highlight that parks are important and really also shows that we have an opportunity to increase their use of parks for that physical activity. Those findings correspond with some of the conversations that youth had in our cognitive maps and photo voice. The youth identified numerous places for physical activity, but parks and open space, again, really emerged as a primary theme. And so this indicates that youth feel that parks are an important resource and desired resource for their physical activity. Now, we're also looking at those playground interventions, and we did systematic observations of the youth and their physical activity in the playgrounds to assess this. Overall, we actually did not find a significant increase in physical activity as a result of those interventions. We saw a slight increase in activity in the intervention schools and a slight decrease at the control school, meaning that maybe the intervention possibly mitigated a general decline in youth physical activity over time. However, we were disappointed to not see a greater impact. But our interviews and observations provide some insight into some of these findings. We discovered that the youth were not allowed always to use those new intervention areas. Sometimes those due to limited supervision capabilities. And then in one case, the new track, which was the intervention, was actually used as the punishment zone for that playground, where youth were made to walk the track if they were in trouble. So as you can see, this probably influenced the youth's desire to use that area in that activity. So we decided to do some follow-up interviews with playground monitors to get a better sense of how they viewed their role in promoting or discouraging children's physical activity. And the playground staff talked about a number of different issues, including school culture, such as safety being a priority over encouraging physical activity. Also, how they interact with youth. Were they engaged in a hands-on approach, encouraging activity, or was it more of a hands-off approach and letting the youth do what they want? And then also how they used physical activity as a bargaining chip to manage behaviors. This includes both reducing physical activity by taking away play, such as timeouts, and forcing physical activity as a punishment, as I mentioned before. So as you can see, although we used a participatory and engaging process to do these interventions, what it really came down to, these playground monitors were really key to the success or failure of our intervention. There's plenty more I could talk about, but I do want to go into another study now, and that is the Kansas City Parks and Physical Activity Project. This is actually a series of related studies with the overall goal of better understanding and improving the way parks promote both youth and adult physical activity. And I do want to acknowledge my co-investigator on this project, Dr. Andrew Kaczynski, who's at the University of South Carolina. So some SEC collaborations going on already. The first study within this was a combination of looking at observations of park user physical activity and on-site surveys of park visitors. And we have a number of different findings from this, but what I want to highlight is overall we saw differences in both park-based physical activity patterns and perceptions related to those park-based physical activity across different demographic and user groups. Just as one example, many park site attributes such as cleanliness and lighting were rated as more important by Black and Hispanic visitors than white visitors. So this really indicates that there's differences in patterns, interests, and needs across different user groups. This study then led into the development of a community stakeholder park audit tool. Cpat is what we're calling it. And the Cpat was developed to enable diverse community stakeholders to quickly and reliably audit their community parks for their potential to promote physical activity. And we really saw that there was a need for this, not only from a research purpose, but also for community members to be able to go in and assess their community parks for physical activity and any issues that might be there. So we did this through a series of workshops and field testing with community stakeholders representing diverse organizations from the Kansas City metropolitan area. And these range from park users to parks and recreation staff, even public health, transportation, various youth agencies, and we even have some high school students involved as well. And what we came up with is a final tool that was 6 pages long with 4 sections: park information, access in the surrounding area around the park, the actual park activity areas, and then overall park quality and safety. And this tool is comprehensive in that it covers key content areas, but it's also user-friendly in terms of the length and format. And this was really important to us, to have this be a tool that community members could use. We also saw that with field testing with the community stakeholders that it did show high inter-rater reliability. This is gaining a lot of interest through a variety of communities across the United States, and we're currently working on next steps of creating and testing an electronic format of our tool in a tablet app format, and working on advocacy efforts with youth. We've also used this for our own research, though. And what we've done is actually audit all the parks in Kansas City, Missouri, and then did a mail survey to residents, and then mapped all those parks in GIS within a 1-mile radius of those study households. We also collected census-tracked income and race data throughout the Kansas City area. And there's many different things we've been able to examine with this, and I'm going to highlight just a few of them. We have found that youth having a park within a half-mile of home are more likely to meet physical activity recommendations than those having no parks, and those with 3 or more parks within a mile are even better off. We've also found that youth with a playground within a half-mile of the park are 2.5 times more likely to meet the physical activity recommendations than those without a playground. We also see that youth with a park with a baseball field or basketball court within a mile home are more likely to meet physical activity recommendations, and various proximal park amenities such as parks with a transit stop nearby, or parks with traffic signals on adjacent streets are associated with greater levels of physical activity. But now we can also use this Cpat to assess disparities in factors and facilities that we know are related to park physical activity, to promote that physical activity. And in Kansas City, what we found was that low-income census tracts actually contained a greater number of parks. This is good news given that a lot of times low-income areas have fewer physical activity resources. However, we found that parks in high-income tracts were the ones to contain more playgrounds. And as we just saw, playgrounds are really important for youth physical activity, so there's less of those resources available in those low-income areas. We also see that fewer parks with trails are in high minority areas, and this is an issue given that trails have been shown to be important for adult physical activity. And we also see more quality concerns, such as graffiti and vandalism, per park in low-income areas. So overall, this tells us that, yes, proximity is important, but not all parks are the same, and parks differ in some of the qualities and features that can influence physical activity. These findings also highlight some of the ways that we can use this tool as an advocacy effort in communities to help identify and address some of those concerns. I also want to talk about some of the other findings from the resident survey. In addition to sort of what we saw in the community, we also see that residents' perceptions of the park quality influences physical activity and health status, both in adults and also park use for youth. And then one last finding I want to quickly mention is that we found that residents needing to cross a high-speed road on their way to the closest park are less likely to use parks. So again, it's not just about proximity and what's in the park, it's also about understanding that access in the surrounding neighborhood. And this really leads into the last study I want to mention. What this study was about was assessing the change in pedestrian crossing behaviors and traffic patterns after the installation of a signalized crosswalk, and how that impacted safer access to the park and active recreation. So the context for this study is that we had a low-income neighborhood on the left over here that was separated from a busy 5-lane highway, separated from their neighborhood park and as well as a high school and downtown area by that busy 5-lane highway. And that created a lot of safety and access concerns. Along that road, there's many vehicles traveling at high speeds. Even though the posted speed limit's 35 miles per hour, we're seeing much greater speeds than that, even maximum speeds up to 60 to 70 miles per hour. And what was happening, there was a lot of safety concerns because pedestrians were really needing to move between traffic to cross the street because there were not many crossing opportunities along a long stretch between this neighborhood and the park. And so what you saw is that people were sort of dodging traffic. The city put up signs to encourage people to go to the far ends and not cross here, but because of that long distance, people were really using that middle turn lane almost as a place to stop. And it really created a lot of safety concerns. And even you'd see this a lot with youth. And this created issues both for the pedestrians and drivers, a very kind of dangerous and challenging situation. So the city decided to make some infrastructural changes, and we had the opportunity to examine that as part of a natural experiment. So the city took down an old pedestrian bridge that really wasn't being used, and it wasn't being used for a number of reasons. There was a lot of fears of crime and safety on the bridge because it had high walls and you really couldn't be seen on it, and so people felt trapped on there, and it was just poorly designed. And then they replaced it with the installation of a signalized crosswalk along a landscaped median. So we had the opportunity to collect data before and after to examine where individuals crossed, how that influenced park visitors and park use and physical activity, and how that influenced traffic patterns as well. And I'm just going to give a few of the brief findings from that. We did collect a control site as well, but I'm going to focus on just that intervention site for now. We saw that that new signalized crosswalk significantly reduced the percentage of vehicles speeding along the roadway. It also increased the number of safe crossings that we were seeing, particularly for youth and seniors, so that's really important. And overall, it improved safe access to Douglas Park. So in summary, what I want to just kind of conclude with is that we know that parks, and we're increasingly seeing that parks are an important resource for public health as a community resource for physical activity. However, we know that parks can differ dramatically with respect to their facilities, their amenities, their quality, and then overall neighborhood context and access. So opportunities really do still remain to continue to improve the contribution to public health through studies like I mentioned today, and there really is a need for continued research and interventions. And we have many exciting directions that we're taking this research with a number of different colleagues. So I hope you can come away with a greater appreciation of the role of parks in serving as a community health resource. I know I kind of gave an overview of a lot of these studies, and so if you have interest in any of these and want to follow up, I'd be happy to provide greater detail on the methods and the analysis and other findings as well. So I'd like to thank you for your time and take any questions.
Hi, Colette Miller, University of Georgia. So you improved the access of the park, but did people actually use it more?
That's a really good question. So we're still working through that because it's not a really simple answer to that one right now. We saw in some areas, in some demographics, we saw improvements, and in others, we saw actual use and activity go down, and we're trying to figure out what was going on there. In terms of the activity, there's a lot of other factors that we tried to control for, but we couldn't really capture everything. In particular, in our park, we didn't know this was going to happen, but there was a reduction in funding for some programming in the park, and so we saw a lot less youth going to the park to access that program, and so it's kind of complicated some of the findings. But we did actually see, again, in some user groups, an increase in the park use and physical activity, particularly in seniors. They were walking to the park, walking around the park, and then actually accessing the downtown more. So complex, and I would love to get into that more, but that's the quick answer.
Last question?
Thank you.